Hi everyone there, welcome to Kids Health Talk. Today I'm going to help educate you much on cholera. Cholera is one of fecal-oral diseases, and there are several other diseases that are transmitted through fecal-oral. These diseases are, there is polio, we also have hepatitis, we also have diarrhea diseases, and also typhoid. In addition, now cholera. Let's move straight ahead on to cholera. What is cholera? Cholera is a very infectious disease which is caused by ingestion of contaminated food, water, or poor hand hygiene. Ingestion simply means eating or drinking. So what contaminates this food or this water is a bacteria known as Vibrio cholera, and this Vibrio cholera is the one that is responsible for causing cholera in a human being. Vibrio cholerae is normally found from feces of an infected person with Vibrio cholerae. And that is why it is very important to maintain hygiene, hand hygiene, in order to prevent someone else from getting cholera. How can someone get cholera? One can get cholera through 5 F's. These 5 F's, I'm going to explain them very well. Now, from feces into your mouth. So, our first F is fingers. For example, you walk inside a toilet, then after you come from the toilet, you don't wash your hands properly. If at all you're infected with Vibrio cholerae, you go touch other surfaces or food or water, then someone else comes and takes that food or water, you can transmit that disease from yourself to the food to the mouth of the other person. I hope you get it well. Our second F is flies. Flies, as we know very well, are very common in our houses or in hotels or in any other place that there is food. So if a fly touches an infected feces, then it comes to contact with food or water, someone else ingests it or takes it, that person is going to end up having cholera. Our fourth F is food. For example, you can walk in a kibanda, then after going to kibanda, you go and ask for watermelon. Of course, they are not going to give you a whole watermelon. They are going to give you a piece of the watermelon. You don't really know how that person prepared that type of fruit in order for you to ingest it. So the correct thing to do is you buy a whole watermelon, then walk with it inside your house, go and wash it using soap and water, then you rinse it very well in such a way that you will break the chain of infection to your mouth. Our fourth F is on fluids. Simply means water. This water, someone can pass stool along the way, and then you find out that you're going to fetch that water that is contaminated. So it is always very important to boil water before drinking it, or simply use bottled water. Our fifth F is on fields, or simply floor. Fields, a person can pass feces and leave their feces on the ground. Then a mango or a fruit falls there. And after it falls there, for example, children will run towards it to pick and eat. So this child can get infected with the Vibrio cholera if at all that feces was infected. So it is always very important to wash our fruits even if we collected them from the grounds that we know. Another part of field is floor. Floor simply means your baby can pass stool on the floor, and after they pass the stool on the floor, maybe they were infected. Then you will, most of the times, you concentrate on picking the stool and taking it to the toilet without concentrating on washing that place where the baby passed stool on. So it is very important for you to wash the floor always, and that is where hygiene comes in. How can we break this chain? Simply by use of toilet. And after using your toilet, you should have a hand hygiene. Wash your hands with soap and water. In this COVID era, we are very much happy because not so many people who are coming in the hospital having been infected with cholera, because people are maintaining hand hygiene, and that is very good of you. Keep it up. Then we have touched on the feces and the fingers. Feces, you use the toilet. Fingers, it is now the hand hygiene. Flies, you can use the insecticides to kill the flies in order to prevent those flies from infecting food or surfaces. Then, in case you are eating food, make sure that you prepare it yourself at home, because you don't know this person who prepared inside a hotel, whether they prepared the food properly. So it is always important, unless you have an emergency, then that is when you can use a hotel. Then in fluids, you're supposed to make use of bottled water, or else you boil your own water at home, in order to make sure that you're drinking very clean water and free from bacteria. Then on the fields, let's stop using our fields as the toilets. Remember, as I told you before, we are supposed to use toilets. Then remember to clean your floor daily or when necessary, so that you prevent yourself or others from infection. Avoid buying fruits that are cut, fruits that are in pieces. Always buy a whole fruit. You go wash it with soap and water at home, and then you can now start cutting it into pieces. What are the signs and symptoms of cholera? One is diarrhea. Diarrhea that is watery diarrhea and has mucus in it. Also, it seems like rice water. So if you get such type of diarrhea that is not stopping, you're supposed to go direct into a health facility to be assisted in rehydration. Number two, someone can get nausea and vomiting, preventing them from being able to eat, and this will weaken you. You can end up getting dehydration. Dehydration will come from vomiting and diarrhea. That is loss of water from your body. And this, you need rehydration in a health facility. If you don't walk into a health facility when you're infected with cholera, you can end up dying at home simply because you got dehydrated. Signs of dehydrations are you can get sunken eyes, your skin can seem like an old grandmother's skin or a grandfather's skin, and even after pinching the skin, mostly on the stomach, it comes back very slowly. You can also get your heart beating a lot in order to compensate for the lost fluid. For example, in children, they will not get tears after crying because they are simply dehydrated. Also, you will get dry mucous membrane because the person is dehydrated. You can also find it difficult to pass urine simply because there is not enough fluid in your body in order for the kidney to excrete urine. How do you treat cholera? Treatment of cholera is simply by rehydration. And if not rehydration, then you need to get an antibiotic which is called doxycycline. It's usually given at 300 milligrams start. Start means once. So you only take 300, that is 3 tablets once in a day, and that's all. Then you go ahead to get rehydration. You have to be fixed a line, then fluid or water is put in your veins in order to boost the lost water already, in order to replace that lost water. If you have vomiting or nausea, you can use an antiemetic or a drug that can prevent you from feeling vomiting or from nausea. With this, I hope you are able to know what cholera is, the ways to prevent cholera, and how to move on if at all you are infected with cholera. Cholera is a killer disease because it can kill you as soon as you get severe dehydration. Thank you for watching. Goodbye. I hope you're going to follow up on many things that I'm going to be educating you through online.